Hi, I'm Jennifer Durain from Equip Health, and I'm really excited to be here on Psych Hub's YouTube channel to talk about binge eating disorder, or BED, which is one of many eating disorders. So, why is this topic being covered? It's important to know that binge eating disorder is a really common eating disorder diagnosis, with many cases presenting in late adolescence or the late teenage and early adult years. However, many people don't share their symptoms with medical providers because they're really concerned about stigma and sometimes just worried about shame. While it affects more females than males, the gender ratio is less skewed for BED than for some of the other eating disorders, which really tend to have a vast majority more female patients. What are some myths and facts about BED? One myth is that eating disorders affect only white, cisgender teenage girls, but we know that binge eating disorder can affect anyone. It presents in all racial, ethnic groups, socioeconomic backgrounds, ages, and it's present in individuals across the gender spectrum. BED is a legitimate condition. It is not a moral failing. We know that people with BED are not lazy, gluttonous, or lacking in self-control. Another myth about BED is that it's associated with larger body size. But again, we know that people can be at any weight and still be living with BED symptoms. Similarly, not everyone in a large body has binge eating disorder. There are many individuals at higher weights who do not engage in eating disorder symptoms at all. So what are common reasons people develop BED? There's some data to indicate that there may be an underlying genetic vulnerability to developing the condition, since BED seems to run in families. Binge eating may develop as a coping strategy. It can also occur in situations where an individual is feeling stressed or as a way to regulate mood and decrease anxiety. It can also be associated with impulsivity and other psychiatric diagnoses, which may occur at the same time. It can be triggered by a combination of hunger and stress, especially in those who restrict access to certain trigger foods in the hopes of avoiding a binge. We know that dieting and body dissatisfaction are common in individuals with binge eating disorder, and there's evidence to suggest that psychological symptoms such as depressed mood are more common in those who engage in binge eating. So what's the most important thing that people should know about BED? The most important thing to know is that help is available. BED is a valid medical condition. It's not a moral failing or an issue worthy of criticism or blame. We have effective treatments and empathic and experienced clinicians who are skilled in delivering them.